Dr. Heather here, and I would like to discuss today with you the O-Shot. The O-Shot. What is the O-Shot? Well, it is a revolutionary procedure designed by Dr. Charles Runnels to treat urinary stress incontinence. That's when a little bit of urine leaks out when you're doing things like exercise or coughing and sneezing. And it also treats women's sexual health. So sexual health, well, as we get older and after having children and after certain medical conditions, things in the vagina can become less lubricated. There's some atrophy, which means kind of shrinkage of the tissues, and it's just not the same environment as it was. These are not conditions that women want to experience, but they also don't always talk about them. Wouldn't it be amazing if there was a non-surgical, non-pharmaceutical way to actually treat these conditions? Well, there is. It's called the O-Shot. And here is a video of Dr. Runnels. He was being interviewed on a morning TV show and discussing the O-Shot, and it's just such an excellent explanation that I wanted to share it with you. And then we can come back and see if the O-Shot is right for you.
The latest anti-aging efforts don't involve surgery or extensive downtime. New youthful options for women are available that use only a shot to bring feelings of heightened well-being and reviving the feelings of intimacy. I'm talking about the O-Shot, and joining me to discuss this approach is the inventor, Dr. Charles Runnels, along with Brenda Skaggs, a nurse with the Artemis Medical Group that offers the O-Shot here in Columbus. Welcome to both of you.
Thank you.
Doctor, it's a pleasure to have you here, traveling in from, Alabama, where you're from.
Thank you.
The O-Shot is your invention.
Yes.
How would you describe it?
First of all, thank you for having the courage to talk about this.
Well, it is important, and I know there's women out there who have issues.
And it's difficult to talk about it. Even though somewhere around 40% of women have difficulty with their sexuality, only 14% of them ever have a conversation with their doctor. And so thank you for having the courage to bring it out. It's such a huge problem.
So how does the O-Shot help these folks?
Well, there are four major problems that women suffer with: either pain with intercourse, or trouble with arousal or sex drive, or trouble with having an orgasm. You know, Emerson called sex and beauty the scaffolding of love. So even though a relationship can develop where it's not as important, it's so important. You know, as an example, I had a woman who lives close to me who delivered a 10-pound baby. And in her 20s, now all of a sudden she has pain with intercourse. She has urinary incontinence. She's trying to maintain a relationship with her husband. And that, it makes her feel unlovable and started to interfere with her marriage, just as one example. And within a month of having this shot, she's back to having comfortable relations with her husband again.
This just isn't a regular shot, though. This is a shot involving part of the person themselves, which is a little difficult for some people to understand how that works.
Yes. Thank you for bringing that up, because there is no foreign body injected. There's no surgery. It's just an injection. But I didn't invent the technology. This has been used for many years by the NFL. They'll draw blood from an athlete and inject it into the knee to help rejuvenate the knee. Basically, the way to think about it, we're creating that yellow goo. Remember when you scuffed your knee as a child and there's a scab there and there's this yellow goo there? That yellow goo is what caused the skin to regrow. And there's a way to make that in about 10 minutes by drawing your blood and activating it with a little calcium. Now the blood thinks you have an injury, and wherever you put that, it rejuvenates the tissue. For at least the past 10 years, oral surgeons have used it, orthopedic surgeons have used it.
So while it's not new in this regard for women, that's what's new.
The new idea was, actually, I invented a way of regenerating the face called the vampire facelift. And the way the whole shot came about was I was treating a woman who loved it so much, she asked me, would you put this in my vagina, because I've delivered 3 children, to see if it makes things feel better. And when I did, so a woman helped think of it, and when I did, the results were so astounding, I started inviting women who I knew that had difficulties to try the procedure, and the results just continued so much. Now we have over 100 doctors doing it, and one of the lead injectors and educators are here in Columbus at the Artemis Center, where they're helping us gather research. We're ready to publish some research about it, demonstrating over 90% efficacy, and urinary incontinence as well, because that whole tissue, the tissue between the vagina and the urethra, is only 1/4 of an inch. So in an 18-year-old, and even 20-something-year-olds, about 1 in 20 of them have urinary incontinence that interferes. So this helps.
Wasn't that excellent? And I'm so glad you got a chance to hear Dr. Runnels in his own words talking about this amazing procedure that he invented. Now, as amazing as the O-Shot is, it really is not for everybody. So you can either click the link below or hit the button below, or you can go to drheather.net/O-Shot. That's drheather.net/O-Shot. Thank you so much for spending some time with us today. We just want to help you live your best life ever.